started, just by show of hands, how many have used generative AI in some way, shape, or form around assessment? Be it to write questions, to answer questions, to score questions, to provide feedback. Anybody using it? Good. And how many have concerns around how generative AI is used with respect to assessment? Bruce has got two hands up. Yeah, worry. Um, I should position myself in this conversation to say that I am not an assessment expert. And I know that there are many assessment experts in the room. So we'll be looking to you, to your perspective. I'm also not an AI expert in any way, shape, or form, though I'd like to think myself as a wannabe technophile. I have fond memories reflecting to my youth where my computer always had its case off and I like to tinker with it. I'm also very, very grateful for collaboration in a journey as an MD program lead, wondering as ChatGPT arrived November 2022, what this would mean for medical school. And my thinking partner, right across here, Leo, has really led the way. He's now on his fifth paper trying to explore the impact of assessment in medical education. And it's been a wonderful journey thinking through this with a student and with many of the faculty in the program, including Anthony, who's here, and Kina, who couldn't be here today. The journey that we went on was really one of stages of grief. And so I'm going to take you through those stages, which I think is a counterpart to the four quadrants that Lorelei showed us. In fact, I think we were in all of those at one point. And sometimes I feel like an evangelist, just to put myself on the spectrum. And then finally want to propose three postulates that are pretty provocative around what our future might be as health professions assessors and what the field might look like. Of course, it is easy to stick our head in the sand. And I remember pulling up ChatGPT in November 2022 thinking, that's cool. Probably isn't going to make any difference to us. Let's just carry on. And then having the faculty member email start trickling in saying, oh, what about the progress testing that we're letting medical students do on their own, at home, unproctored? Is that a problem? No, I don't think so. And you know, it quickly became apparent that this took off. This hit records for 100 million users in just shy of 2 months, vastly quickly and repeatedly making this landmark beyond a lot of social media platforms, only outdone by Threads here. But I think we still live in a very conservative community, this being a survey done in 2022 of a couple hundred medical school faculty and medical students across 5 continents, where familiarity with artificial intelligence, even generative artificial intelligence, was shockingly low. And even more to the point, amount of training pursued in generative AI was basically none. I don't think we can hide for long, though, as we realize that the ecosystem isn't just limited to these large language models, but actually an entire layer of development tools and a whole bunch of user applications that take each of the individual use cases that we might wonder about and allow us ease of access to a technology that no longer requires computer expertise, that no longer requires understanding of deep learning or machine learning, and really puts it at our fingertips in a second. And so there was a moment there of concern, maybe even anger, as faculty, programs, and institutions came to grips with What does it mean when it's easy to provide answers to assessment and students can do it by just snapping a picture of a multiple choice question and ChatGPT will say C? And we had a whole range of responses. Here, top French university bans use of ChatGPT. And in Forbes, ChatGPT, a threat to higher education. And we still have a diversity of institutional approaches when we go to conferences with the haves and the have-nots, those that have no access within an academic or university circle, or an attempt within the university to build a closed large language model, and those like Kevin Eva's statements where all the guardrails are off. And I think it's quickly coming to a head. You know, we've had this litmus test of artificial intelligence philosophically around since 1950 that challenge us to identify and separate out human from machine, the Turing test. Could AI imitate just like a human could imitate? And could you tell the difference? Well, a group out of Stanford feels that using ChatGPT 4, it solidly and easily passes the Turing test. That it is virtually impossible to identify human from artificial intelligence when given these brief prompt-like questions. Now, admittedly, the higher creative writing domain is something completely different. But this, I think, gives us a moment pause that in conversation alone, it's pretty much indistinguishable. And we've seen educational studies in this domain looking at higher educational assessments where teachers can't tell. And when they think they can tell, often they're wrong. I had a master's student who has an ethos that's beyond reproach, who has a dedication to writing and had her writing questioned, that it just sounded too good, that it must have been from ChatGPT. And yet when you put it through the AI detectors, actually, they side with human generated material. And yet a faculty member was convinced that the level of writing was too high. And I think this is a clarion call that we need to thoughtfully think about how AI gets integrated into education. We need to reevaluate our assessment practices, increase our awareness of not only AI capabilities, but also limitations, and then determine where are we going to focus on the student skills that we develop and cannot easily replace. Our very, very early exploration into this was to try and understand, could we privilege complexity of thought? Was there a way of crafting, smithing questions that would be beyond the reach of AI? And so here we looked at short answer questions that are part of our MD program across Bloom's taxonomy and subjected them in those days to Chat GPT 3.5. And actually, there was no difference from the very kind of simple, direct fact to analysis, synthesis, and questions that asked for creation within them. We couldn't tell. Ironically, AI can. And AI is better at detecting AI than we as humans are. And in fact, there's a whole range of AI detectors out there. None are perfect, but Turnitin, which is actually the AI detector that we subscribe to at McMaster that's embedded in Avenue to Learn, is actually leading the pack at the moment. Interestingly, these detectors are best at detecting human writing. They're less able to detect translated writing, so where a human's generated it, but then it's been translated by machine into English, that's 2. And a little worse yet, detecting AI writing with a variety of prompts. And certainly there's a whole complexity to prompt engineering that can create a diversity of outputs. Where they fall apart is in the editing realm. such that if you have AI generated text that then subsequently edited either by human or machine, the accuracy is somewhere between 20 and 45%. And so we started to bargain. Okay, if we can't exclude, then how do we live with this? And we certainly understand that students are willing to live with it. This was data from surveys of higher education students that have a general willingness to use across a whole spectrum the personalized nature of support that a chatbot could provide in the middle of the night when an assignment is due the next day of how do I do this? The support around brainstorming, around writing, around synthesizing or analyzing data to generate media. A lot of the graphics here were generated by AI, as well as doing the drudgery that Lorelei alluded to, those administrative tasks where it can rinse and repeat with ease. But even students have concern about accuracy and transparency, about the ethics of what it is to then be collaborating with a machine on their work and what that means about human values and their career prospects as future health professionals, as well as a lot of uncertainty around how programs and institutions will think of hybrid work. We've also seen educators try to grapple with it. Here's one attempt to write multiple choice questions where ChatGPT was found wanting. But I might foreshadow a little bit here and suggest that one of our postulates is that we shouldn't accept large language model outputs that fall below the median of a group, and that we can reasonably expect at least median performance with appropriate use of the technology and prompting. We also started to grapple with, well, what's the trade-off behind trying to secure assessments and what it is that we're trying to assess, recognizing that across Miller's pyramid, it becomes more difficult to secure the pure knowledge tests. All of us moving in our COVID worlds to asynchronous and virtual testing now had to reconsider, are these constructs that we want to retain? And if so, why? and what about moving towards behavioral assessment, towards assessment and practice, where it becomes a lot harder to collaborate with large language models and generative AI. Our own university has taken an explainability type approach, asking educators to make clear to learners how it is that they could use AI, how it is that AI could be used in assessment, and vice versa for learners to be transparent and appropriately acknowledge when AI has been used. Of course, there's a whole bunch of murkiness in the details, what exactly that disclosure is on a student's end, and how much a faculty then should go into the detail about individual context. But I think at least it lays a groundwork of a framework for our conversation as educators and assessors. And it's certainly not a road that we're going alone, with a similar stance taken by Harvard and a clarion call not to ban ChatGPT here in the New York Times, but to incorporate it and try to leverage it as much as we can within an educational context. And so I think that's brought us to an acceptance that it is here to stay, good, bad, or ugly. We can't roll back the November 22 clock. And we start to plot where we are. You know, I can harken back to a time where it was easy to best artificial intelligence at no matter what the skill set was, and that it was woefully inadequate and woefully inaccessible, taking long periods of time for, say, clinicians to try and get an answer out of a machine. Well, we had a period where there was a lot of engagement around deep learning and with very meticulously crafted data sets and gold standards and those experts at leveraging machine learning. There could be very specific use cases where it could outperform humans. I would argue that we're starting to move beyond that and that we are in that conceptual future where there might be complex tasks where large language models and generative AI can outdo our efforts. And I think that comes with a whole bunch of risks, and risks that are really material and important as we consider assessment. I think all three of us as presenters have alluded to the challenge of bias, this clarion call for more explainability and transparency around training of models, what that means when temporally they were trained, linguistically around how they were trained, the sociopolitical mass of information that was culled in training them. But I think with an assessment lens, most importantly, it's about how we define the construct relevant assessment variance that we're trying to capture, trying to understand what it is that we're trying to measure and distinguish amongst learners, and making sure that the window that AI has, if it's permissioned within that, only fits or as best fits that construct relevant variance. And that we don't let construct irrelevant variance, that stuff that shouldn't be assessed, but is inherent in our biases, infiltrate through. I mean, this sounds like best practices when we strip names away and we try and anonymize, say with manuscript review, these types of things that help ensure that we're really focused on measuring what we want to measure. But of course, lots more work needs to go in to try and understand how do we parse that out. And of course, that doesn't touch also the inherent biases that permeate the training of models. There's also this issue of hallucinations, or as Anthony wants to rename confabulations, about how that transformer mechanism of these generative AI large language models is really just probabilistically predicting the next word without really a conceptual grounding or understanding of what's behind it, as well as the difficulty in trying to merge sources as it pulls from two different, maybe even contradictory sources, and then creates a composite that has no logic in it. And then finally, this challenge of shallowness, where the minority, underrepresented opinions, the nuance and the complexity won't come through in an answer. Where you've got a large range of decision making, it's really a very blunt instrument, picking the dominant ideas. And then finally, I think we have to worry about what Gen AI is really good at and how it can be manipulated to those strengths around nefarious uses, how data from learners, how data from patients, how data within the healthcare environments then might enter into these tools and then be captured for other purposes, as well as the standard challenge that we all have about could they be cheating? And how do we try and navigate that challenge of access to tech and appropriateness of tech in our assessments? So I wanted to put three controversial postulates forward that I think we should grapple with as assessors in health professions. And then look forward to your own thoughts about that and more at the end. First, I think we should reconsider what our assessment constructs are in a generative AI era. And I have the lens of a physician in a health workforce environment, trying to grapple with what it is that we do every day and how we align training, competency, and assessment to that everyday reality. We've been living with this for a long time. I'm a cardiologist. I gravitate towards ECGs. I spend a lot of time thinking about ECGs. But to be honest, the computerized interpretation has been with us since the 80s, and it does a near perfect job, to be perfectly honest. It'll put a star, 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 and say to the dear clinician, you need to attend to this, and here's the diagnosis. And we've seen over the last 2 decades a move away from assessing learner competence at reading masses of ECGs that's been de-emphasized in licensing and credentialing processes, and a move more to overreading, to how there's an interaction between interpretations that are provided and then detecting errors, overreading mistakes. We've seen machine learning enter into clinical workforces here with FDA-approved diabetic retinopathy detection. And in fact, these tools are rapidly growing at nearly several hundred a year. And this was before the generative AI era. I'll show this graph that's really hard to see, but actually has an inflection point starting about 2012, and then just takes off like a rocket ship with a tremendous amount of interest, engagement, and development going on in a machine learning and deep learning space to equip clinicians and patients and systems with better ways of diagnosing, detecting, and prognosticating. And no doubt, there's all sorts of limitations to this technology, but I don't think we can ignore its gradual incorporation into our everyday workflows and what it means about what competence and expertise sets we retain as humans and what we delegate. With the advent of electronic medical records, we've seen large language model and generative AI integration. Here, associated with Hamilton Health Sciences, there's a trial ongoing at the moment to automatically generate discharge summaries, to record patient-provider interactions, and automatically create notes. That's our everyday. And if that's our everyday, do we need to spend as much time trying to train learners in summarizing and generating these clinical documentation components that increasingly have become longer, more detailed, more incorporated across multiple health records? It's unclear. Consulting data would suggest that 25 to 30% of healthcare providers have already integrated some generative AI into their everyday workflows, and that 40% are willing to pursue pilot projects, tests of concept. And as a result, accreditors and credentialers are starting to think through what the landscape might look like. Our own Royal College of Physicians and Surgeons is engaged in a process thinking about what AI might mean in medicine and how it might transform competence learning and practice. I think at very least, we need to be aware that this is entering into our workplaces and that learners are now learning alongside technologic adoption. And we should be incorporating some part of the critical thinking around large language adoption and generative AI adoption within our assessment paradigm to understand the methods that are used in order to incorporate it, the sources that it draws upon, and the potential biases that might exist in its use. My second postulate is that we should expect that generative AI should perform better at assessment tasks than the median of any group that we identify. I would suggest that this falls from training a large language model on a corpus of data that spans the internet as a whole, complete with its biases, that many of the groups that we're interested in will have their knowledge sets represented in some way, shape, or form. And that with appropriate sculpting of the scope of the training of the large language model and appropriate prompting, that the performance level should hit the median of that group. And in fact, having run this by some AI experts, they would put forward that the threshold probably should be somewhere between 80 or 90% as the expectation of performance. And that if we're falling short of it, we're actually not levering the tech to its purpose in the right way. This is sort of reflected in the data that we keep seeing published. Here, a whole host of large language models taking all three credentialing steps of medical training, standardized testing in the US, with passing scores regardless of the model and its generation. And of course, more broadly, across all sorts of different standardized testing, Lorelei will be pleased to know that AP English literature is the one that no model could get anywhere near passing, but all the others were toast. And I think we're seeing rapid improvements in the model parameters and their ability to perform. Here, just showing the difference between ChatGPT 3.5 and 4 with nearly a 50% change in the percentile on all of these standardized tests. Finally, we've recently seen the idea of chain of thought being integrated in large language models, which creates not a logic, but a sequencing to which material is generated that actually outperforms experts, faculty, and PhD students on PhD level science questions, which I think gives some pause around the complexity that we generate and where the testing securitization threshold might be as large language models continue to iterate. Within our own medical sphere, we've seen ChatGPT 4 outperform all clerkship exams in all domains and disciplines. And interestingly, even see it outperform physicians on medical questions by consumers. So here's a set of 1,000 medical questions that were put to physicians and also put to a large language model trained on medical data, MedPalm, MedPalm-2. And physicians arbitrated the answers. They didn't know whether it came from a physician or the large language model. And looking at the data, the large language model outperformed physician answers as adjudicated by physicians, really across all of these different constructs, including bias and harm. Similarly, if you put it to patients and lay people, there's an equivalent preference for large language generated models and physician generated answers to these types of questions. Suggests we're almost at an era where these are going to be indistinguishable. So I'll leave with the last postulate, where I'll propose that as assessors, generative AI should be a required part of our toolkit. And if I think about what we do when we set about constructing an assessment, there's a whole bunch of non-generative components to the assessment where we contemplate its fundamental purpose, the decision that we're going to make, the standard that we're going to set, the consequences that fall out. And we set about a validity argument about how we're going to defend those decisions. Those core components, I don't think there's any way of using large language models to do the thoroughness and the deepness of the thought around it. But there's a whole bunch of generative components of elaborating competencies, I think a bit like learning objectives, creating blueprints, writing items, vetting items, developing rubrics around items, sampling those items in order to create a test, scoring them, and generating feedback on them, where I think we can leverage generative AI in our regular assessment work. And I think there's substantial scalable benefit here. If I think across what an assessment team looks like as a composite of educators, statisticians, content experts, and stakeholders, there could be a lightening of the load, in particular around content experts. Often, these are clinicians who are being pulled away from the clinical environment to help create, score, and provide feedback around assessment. Their time comes at a significant opportunity cost and just a frank monetary premium, which could be offset in part by generative AI. I'm not suggesting a one-to-one substitution, but I think there can be some scaling here and some hybrid involvement. And we've seen a fair amount of literature that started to hint at all of these areas where generative AI will help as a toolkit within our assessor framework. Here are 12 tips about how to generate multiple choice questions so you don't end up with the idea that it's inferior to human content experts trained to write multiple choice questions. And in fact, when put to the test, it's actually shockingly quick and easy to generate items. Here, I've used a large language tool, Perplexity, that grabs sources and then uses those sources in order to generate questions or material. And If you privilege all of the best practices around assessment item writing, the psychometric properties seem similar, if not indistinguishable from that of human-generated content experts. There's early work looking at generative AI as a scoring agent. We did some in our MD program. And it seems that you can get it to the median of a trained group of assessors, which is sort of what you would expect. There's also work looking at how generative AI could create feedback. And I think there's strengths and weaknesses of the type of feedback that's generated by a large language model. But at least in some constructs, it seems indistinguishable from that experts can generate. So I'd like to prompt discussion by suggesting that we are in an AI-enhanced world. We've gone through our stages of grief as an MD program. I think the assessment community has also come along on that journey. I do think for educators who assess, it is not business as usual, and that we really should re-examine the constructs that we're assessing on and how those should iterate with a different view of the workplace. That we should expect generative AI to perform better than the median of a group when we're setting up knowledge-based assessments, and then try and figure out either how are we going to secure that or deprioritize that in the training pathway of the future health professionals. And then finally, to figure out how we'll integrate generative AI into our own work as assessors as part of our toolkit. I'll leave you with these postulates. If you point your device to the QR code, it will allow you to weigh in on them. And I'm hoping that after we have a chance to hear from each of the groups, we can pull up your collective opinions to see whether my evangelistic postulates really fit the temperature of the room. Thanks so much.